I'm Thomas Dovan, and this is my partner, Sam Crosby.
Hi, I'm Sam Crosby, and Dr. Dovan and I enjoy working together so much on a clinical level. Right now, we decided it'd be appropriate to kind of come to your house while you're all social distancing and isolating, and maybe bring you some information about the hand and upper extremity that may help you with your home offices and your everyday life to kind of make things easier on you and hopefully bring a piece of Elite to you in your home today.
Dr. Crosby, we felt that talking about carpal tunnel syndrome would be a good start, especially since everybody's at home using their computers more. Dr. Crosby, why don't you take a minute to talk about what is carpal tunnel syndrome?
Carpal tunnel syndrome is probably one of the most common 3 or 4 conditions that both of us treat. The way to look at carpal tunnel syndrome is kind of a pinched nerve at the wrist. So carpal tunnel, there's actually a tunnel that goes through your wrist. There are tendons that run through that tunnel, and also the median nerve, which is the structure that gets pinched in the wrist. The median nerve controls the sensation in really the thumb side of your hand, but a lot of times people experience it as their whole hand going numb intermittently. Is there anything you'd like to add, Dr. Dovan?
I think that was a great summary. And, you led us into the symptoms. And really, I think the most common symptoms we'll find is the numbness. And the numbness can be numbness alone, but it also could be numbness and pain. And that combination is what really drives people in to see us. And it could be I'm typing, I'm writing, I'm doing something with my hand during the day, and all of a sudden it goes to sleep. And as you know, the night symptoms are some of the most aggravating. People actually wake up and their description is, my hand is asleep, I've got to shake it awake. And that is a very common scenario with carpal tunnel syndrome.
That's exactly right. And I tell people, all the time, people ask me, when should I seek medical treatment? When should I have surgery? And there are really 3 big drivers of people coming in to see us and really people seeking surgery and medical treatment. I mean, one is when they can't do the things they love, but another is when they can't sleep at night. Anything that interferes with your sleep, and especially waking up with burning hands, one hand or both hands on fire, really drives people to the office. So, Dr. Dovan, if somebody comes in and they say, hey, I'm sleeping at nighttime, my hands are burning, we probably have the same first step that we start with. But what's your first recommendation is kind of something they can do to help with the nighttime symptoms of waking up at nighttime with numbness in one or both hands?
A great question. And really, as you know, or as you usually do, we see what treatment's been done before. So if they come to us and they say the symptoms you're describing, no treatment, I think the first thing to do is you get them a wrist brace. We call it a carpal tunnel splint or wrist splint, and you have them wear them when they sleep. So when you're sleeping, you tend to bend your wrist, and that increases the pressure on that nerve. And so we give them a wrist brace at night, and then we follow that. You can give them a week, 2 weeks to 4 weeks, and just see if that's improved your symptoms. And that's a great way to start. And for a lot of people that are early in the syndrome, it works fantastic.
And that's exactly right. And sometimes it's even helpful. I mean, if you want to go to a drugstore or pick out a brace on Amazon, there's 2 keys to the brace that you pick out. The 2 things I tell people is find one, first off, that's comfortable. If you have a brace and you try to sleep in it and it's not comfortable, it puts pressure on one side of the wrist or the other side of the wrist, it's a deal breaker. And the second is find a brace, like Dr. Dovan said, that keeps your wrist in a neutral position. We know from basically studies on the body that when you tend to sleep with your wrist in a flexed position or bent position or an extended position, it increases the pressure in that tunnel, and that's what makes the nerve fall asleep, and that's what makes you wake up with pain and numbness in the middle of the night. Along those lines, Dr. Dovan, one of the things that we've been talking about that may be helpful for some people at home as you're doing these home offices to think about, what advice would you give our patients? Basically, how should they set up their home office, and what type of position should their wrist be in when they do computer use and things like that?
Great question. Really, for computer use and really all activities beyond computer, any prolonged position where your wrist is, like you said, flexed or bent or even extended, even if you're not sleeping, that's going to increase the pressure on the median nerve, which is the carpal tunnel nerve. And so you really want a neutral wrist position. And the other thing, you don't want pressure. The carpal tunnel is right here. So you don't want pressure on that while you're using it. And the other thing you talk about is taking frequent breaks. Doing something for a prolonged period of time without a rest in posture is likely to contribute to your symptoms.
Yeah, that's exactly right, and that's the advice I give everybody as well as they're doing computer work. Is first off, it all kind of starts with your posture, the posture of your whole body, the posture of your core, the posture of your wrist, but listening to your body as well. So if you're starting to do computer use and you're starting to feel your hands fall asleep, take a break, stretch, change your position. And the height of your chair, making sure that it's not putting you in a position where you're, having your arms at a flex position, or you're way over your table where you're having to extend your wrist all the way back, but where you're in a good neutral position. And that kind of brings us to another point, computer use. I think, Dr. Dovan and I communicate about a lot of the different conditions we treat, and I think we have a pretty similar position on computer use and carpal tunnel. But Dr. Dovan, what's your position on whether or not computer use contributes to carpal tunnel syndrome, and what are the causes of carpal tunnel syndrome?
Yes, these are great questions. You open the door to causation, and I think we can kind of sum it up in saying that carpal tunnel is a condition. It's an acquired condition. I term it as a condition of life. Our bodies change as we get older, which is really best manifested by looking in the mirror. As we get older, we don't look the same when we're 50 as compared to when we're 18. Well, the same changes go on inside the body. So the carpal tunnel ligament thickens, it narrows the tunnel, and then you get that critical narrowing, and it puts too much pressure on the nerve. The thing is, it doesn't mean that computer use or typing won't bring on your symptoms, but the data suggests that those are not the cause of the problem. It's like when you have knee arthritis and you go running, your knee hurts, but that run that day probably didn't cause your arthritis. So it's a similar scenario. How about you? Any other thoughts on that?
Yeah, that's exactly, what I tell people. I like your terminology that it's a condition of life, and much like everything in life, a lot of it you get from your mama or your daddy. There is a genetic component to carpal tunnel. A lot of times you'll talk to people whose, mothers or sisters have had carpal tunnel syndrome. It's, when you talk about cause, it's really your body composition. There are a lot of contributors to what creates your anatomy or the way that you've made, and also the way your anatomy functions, and those kind of all combine to cause carpal tunnel syndrome. And like you said, there are a lot of exacerbating factors. There's some thought that maybe doing repetitive activities, say in a factory or in a job where you have to repetitively squeeze something, contribute. But the common misconception is that you can only get carpal tunnel syndrome if you spend 8 hours a day on a keyboard or doing computer use. And that's just really proven to be not true. That whether or not the computer use contributes or is a contributing factor is somewhat debatable. But yeah, that's exactly right. It's a condition of life and age and just being a human and a lot of the contributing anatomy factors.
But Dr. Crosby, I'll give you a scenario. I came in to see you, Dr. Crosby. My hand goes to sleep during the day. It's when I type. It's when I work in the garage, in the yard. But really what's been bugging me is at night, and you recommended a wrist splint, and I've been wearing it at night, and it's helped at night, but I'm still getting all these symptoms during the day, and it's now been 3 months. What should I do next?
Yeah, so now we're starting to get into some of the more longer lasting treatments, and there's kind of two ways to look at treatments. One is temporary relief. Carpal tunnel injections can give you a period of temporary relief. The idea behind an injection is you inject the steroid into the carpal tunnel right around the nerve, and that decreases the inflammation. How long that relief lasts is kind of variable. It does not fix the problem permanently, but that is an option. What's the role of steroid injection in your practice, Dr. Dovan?
I'm the same mindset of what it does for you. It shrinks the tissue in the tunnel, so it gives the nerve more room to breathe. But in our experience and what the data shows, that is in most scenarios temporary. So for me, I use it when a patient has a reason we shouldn't do surgery, maybe too risky for surgery, or really their life right now can't handle surgery, and that's a fine decision. And so that's when I use it, but I don't use it as a step towards further treatment. It's an option. For some, it's a bridge to surgery to give them some relief.
That's exactly right, and I look at it the same way. And just as a little bit of a spoiler, I think we both have an underlying tendency to treat carpal tunnel surgically just because the surgery does so well. I mean, it's a condition that most hand surgeons and both of us love to treat because it's one that we fully understand. It's one that we know how to treat really well, and as long as expectations are proper, I think we both feel that surgical management is a good option. And I'm like you, I really mostly give injections for people that, one, can't have surgery. I'd say that's a lot of times pregnant women, which does happen. Sometimes you get carpal tunnel when you're pregnant. People who are too sick for surgery, or for whatever reason, people whose lifestyles just can't accept a surgery in that timing. Would you agree with that assessment about the surgery for carpal tunnel, which is carpal tunnel release?
Absolutely. We think it's a great treatment. The outcomes are about as good as we've seen for any surgery. And then really the question next is timing. Who should have the surgery? When is it too late? What are your thoughts on that?
So who should have the surgery kind of goes back to what I was talking about, is when it's significantly interfering with your life, when it's interfering with your ability to sleep, and when the conservative management, which is the nighttime bracing, hasn't fully worked. And then I always tell people, the one important thing, and we haven't talked about this before, but you probably feel the same way, is you want to get to it before you get the constant numbness. So you want to get to it in that state where the numbness and tingling comes and goes. If it gets to be numb all the time, sometimes that pretends that there's irreversible damage to the nerve that may not wake up with surgery. And a lot of times with that constant numbness comes the loss in the thumb muscle. Is that kind of your feelings about when to get to it?
Yes, and a great analogy I was given, which is, it's not perfect because the nerve is not a pipe where water flows through it, but if you think of it as a garden hose, carpal tunnel is if someone's foot stepping on the garden hose, the water cannot flow. You take your foot off, the water flows, you're back to normal. As you talked about, permanent damage would be considered dirt in the hose. You can take your foot off the hose, but it's still not going to flow. And that's where the surgery will not provide complete return of function. And as you know, we don't know when that happens. I think some of the basic tenets of that would be if you're numb all the time or becoming numb more often, that's definitely a warning sign, or even maybe too late for permanent damage. And then, as you said, the weakness of the thumb. What are your thoughts on that?
Yeah, that's exactly right. I think that's a great analogy, and a great way to look at it is the dirt in the hose. You want to get to it before you've permanently damaged that nerve to where it won't recover when you take your foot off of it or you take the pressure off of it. I mean, that's all you do in carpal tunnel syndrome. As far as the technical part of the surgery, is the whole basic principle behind it is you just cut the roof of that tunnel, and when you do, the roof spreads apart and increases the volume of the carpal tunnel about 25%. So like you said, once you take that foot off the hose, how much of that recovers?
I hope this has been helpful. We enjoyed talking to you today about carpal tunnel syndrome. Please stay tuned in for our next episode, which we'll talk about tennis elbow.
As always, Dr. Dovan, it's been a pleasure hearing your thoughts on similar conditions we treat, and not surprisingly, we feel pretty similar about the pathology and first steps in treatments.
Thank you, Dr. Crosby. It's always great to collaborate with you. I think our team effort to patient approach and care has been very beneficial, and we look forward to doing this again.